Safe staffing will always be a challenge. It's not easy. It's not just about the numbers, and it's not just about the nurses. It's about the impact for patients and the challenges to ensure that our patients receive great care, be it in a hospital bed or in a community setting. Last year, Jane Cummings, our Chief Nursing Officer for NHS England, published a new nursing strategy which identified 10 commitments. And the refreshed NQB guidance, which was published recently, also identifies the importance of having the right people in the right place at the right time. I was therefore very pleased when Ruth May and Mike Durkin of NHSI asked me to lead a piece of work looking at safe, sustainable staffing in mental health. In establishing the group, I was keen to ensure that we had a wide range of people on the group to influence our thinking and shape our future guidance. It was great to have involvement from the RCN and also from occupational therapists, finance colleagues and academics. We also engaged with service users and carers to ensure that their views were heard. We clearly looked at the literature that was available and the recently published NICE guidance. It was good to have the contribution of Nicola Leese, who had been involved in the development of the NICE work related to safe staffing in a mental health environment. The scope of our work is not just focused on inpatients. It covers community and also specialist services such as child and adolescent mental health services. And in doing our work, we are minded that there are other work streams that can help contribute to the work we are doing who face similar challenges. Perhaps it's not surprising that some of the themes that emerge are consistent with previous themes. How to assess acuity, the role of professional judgment, and how do you plan a workforce for a future model of care rather than the current model of care. We should not fail to learn the lessons from our colleagues in adult nursing and children's and community nursing. There are many similarities, but equally there are many differences. Many of the people we care for don't choose to be in hospital and are detained against their wishes. Organisations will want to assure themselves both internally and externally how they benchmark in comparison to their peers. They will want to use the data to assess the need of dependency and acuity, but alongside data, the importance of professional judgment cannot be underestimated. It is that judgment, day by day and hour by hour, that is required to keep our wards and our staff and our community teams safe. Innovation is key to taking this agenda forward. There are many examples of innovation that are helping us staff our services differently, more efficiently, more effectively, and resulting in better outcomes for patients and staff. We are keen to hear of some of the fantastic examples in local services and to share them. The resource that we will produce will help both frontline clinical staff and board members to ensure we get the right people with the right skills in the right place at the right time.